and welcome to another episode of Caring for You with me, Dr. Terence Drew. Let me express how elated I am that you would have been joining us on the last episodes. And those of you who are new, we welcome you to, of course, go back and take a look at those through our Facebook or through our YouTube pages. Today, however, we will be dealing with a very common condition that affects fundamentally young women during their childbearing years, the best years of their life. And this condition is lupus. Recently, I think that you would have heard some information with respect to it, but today we want to get more in depth so that you can inform yourself, your family, community, and we can be better, healthier as a result. So today I want to give that definition. It is an autoimmune disease. An autoimmune disease means that the body's immune system, which is the body's defense system that fights infections and cancer, it turns on the body and it can affect any part of the body. And so it normally affects women between 15 and 44 years of age. Now, what are the common symptoms of lupus? I would say that lupus can have almost any symptom, as this can affect almost any part of the body. But commonly, you can have muscle and joint pain, fever, rashes, and the most common rash or the most typical rash is the rash that we call the butterfly rash, where it is across the nose and the cheeks. And it normally appears when someone is exposed to sun. You can also have chest pain, and chest pain can be as a result of inflammation of the chest wall or the lining of the lungs or even the lining of the heart. It affects the hair, where you can have alopecia or loss of hair loss, and it can come in patches. Persons can have sensitivity to light and sunlight, so that when they go into the sun, they get sunburned easily. At least they feel that they're being sunburned. So this is sometimes one of the first manifestations that people might have. You can also have kidney problems, where you see yourself swelling, not recognizing that it's a result of the kidneys that will be failing. You can have blood in the urine, protein in the urine, as a result of the kidneys being affected. The other one is mouth sores, sores in the mouth. Persons can get sores in the mouth for different reasons, but this can also be a manifestation of lupus. The other one is fatigue. And I see persons with fatigue all the time, chronic fatigue, and they don't know why they're tired all the time. And sometimes it turns out to be lupus. Or those who might have lupus, if they're not managed, or if they're managed, they can have some level of fatigue. It just depends on which symptoms would affect which patient more. You can have anemia, which is low blood, and that can also contribute to the tiredness, the fatigue, the lack of energy, and so that always would have to be looked at. You can have memory problems, forgetfulness, some confusion. Some people can go on to have psychosis, what we call locally, and I hate to use the term, but for you to understand what we call being crazy, but is the lupus attacking the brain. So any young person who have any manifestation of mental illness, especially depression, psychosis, and so forth, lupus must always be ruled out. Blood clotting. Patients can have blood clots in their legs that can go to the lungs and can cause serious issues if they're not caught early and treated appropriately. And also the eyes. The eyes can be affected. We can have dry eyes, inflammation of the eyes, red eyes, the eyelids and can develop rashes and so forth. And so from this spectrum, you can see that lupus can affect almost any part of the body. Hardly any part is spared. So you say it can be a disease that can affect from the crown of the head to the sole of the feet. Now the other question is, once you develop these symptoms and you go to a doctor, how do you diagnose it? So we diagnose it, and this diagnosis, the criteria, come from the society, the Rheumatological Society. And there are 11 classical presentations, and out of 11, 4 would have to be present, 4 or more, in order to diagnose lupus. But there are a number of persons who may not manifest those 4, and those 4 can take sometimes years to develop. Some people who are diagnosed eventually with lupus would tell you that I was having symptoms maybe 4 or 5 years earlier. I just used to feel tired, went to the doctor and he couldn't find anything. And then afterwards I had the joint pain and then the joint swelling, the loss, the hair loss. And then those symptoms that continue to present themselves will give the doctor a better opportunity to diagnose your condition. So sometimes it takes years for a doctor to really zone in as to what would be causing your symptomology. Now, out of those 11, 4, as I said, should be present, and they basically center around what I just mentioned in terms of the manifestations. I wouldn't get too deep into it as I want this for general knowledge, but your doctor definitely will know what to look for. But nonetheless, there are some blood tests that I would like you to be familiar with, and that is what we call the CBC, or the blood counts. Your blood counts can be low, which means you might have anemia, or your white blood cells, which deals with infections, those can also be low. And we test for some markers, one that we call the ANA, which is an antibody. We check for what you call the double-stranded DNA, the anti-Smith. These are antibodies, the anti-Ro, the anti-Law, or the SSA, or the SSB. So we check for a spectrum of antibodies, which also help in the diagnosis of lupus. But once you would have had these symptoms, you go to the doctor would have done a series of blood tests, including those that I just mentioned as specialized tests. And the diagnosis comes back that you might have lupus. What would the doctor do? What is the treatment? Now, the treatment is centered on a number of pillars. 1, to prevent the flares. 2, treat symptoms when they happen. And 3, very fundamental, reduce organ damage and other problems. And these are the 3 pillars of treatment when it comes to lupus. So how do you prevent the flares? Now, the flares are considered to be an escalation of your symptoms. So all the symptoms that I mentioned earlier, when they escalate, we say that you have a flare. And so we want to prevent these flares. So how do we prevent them? The number 1 medication is hydroxychloroquine, Plaquenil, that same medication that was being trumped initially as being effective against COVID-19. I remember it was very difficult for patients who needed Plaquenil for their conditions who could not get it. And in addition to that, the prices were skyrocketing. But after the studies show that it may not be as effective as initially thought against COVID-19, all things went back to normal. Nonetheless, the Plaquenil or hydroxychloroquine help to prevent flares, help to prevent serious complications from lupus. And so all patients who are diagnosed should be on this medication unless they have a serious contraindication. The other thing that would be encouraged is, of course, lifestyle changes, which are fundamental. Watching how you eat, eating as natural as possible and as less processed food as possible, that also helps to prevent the flares. Exercising, in a moderate rate can also help to prevent it. Managing your stress level can also help to prevent flares. So it's not just hinged on medications alone, but your lifestyle changes would also have an impact on preventing the flares. Now, once you get a flare, what are you treated with? A person should be treated with, fundamentally treated with NSAIDs. Those are Motrin, Advil, and so forth. They are treated also with steroids, with help to dampen. But steroids helps a lot when it comes to flares. And how do you prevent the organ damage? By making sure you do everything to prevent these flares, by taking your medication, managing your life, as was discussed earlier. And even though you might be diagnosed, or someone you know might be diagnosed, or whoever is diagnosed, if you follow these pillars, there's a good chance that you can prevent end organ damage and continue to live a fairly good life, even if you are not cured. Thank you very much, and I'll see you on the other side, where we'll now meet our special guest, who will introduce herself, give you some information about her personal experience, and have a conversation with you about her organization and why there is a campaign now to educate our population. when it comes to lupus. So see you on the other side.
It's the new and improved SK Newsline Android mobile app. With the SK Newsline app, you can watch your news reports, the SK Newsline newscast, sports, special features, and so much more. You can also send us a WhatsApp or call us directly. Go in the Google Play Store, search SK Newsline, and download the app today. The SK Newsline mobile app. News on the go.
An open interactive event can be described as
tremendous, effective,
on par with any conference around the world.
From exhibitions to trade shows, corporate events to product launches, from press events to political functions. We are the secret sauce behind events that make you go, wow. We've staged multiple world-class events in the Caribbean and developed the skill to deliver quality in every detail, whether the event is live or fully virtual, or maybe even somewhere in between. At Open Interactive, we got your events covered. Get your free quotation today at www.madebyopen.com.
Want to buy some fresh fruits, vegetables, or ground provision, but don't have the time to go to the market or even to find parking? Look no further. Green Market and Delivery is your solution. Green Market and Delivery is an e-commerce store that sells and delivers local produce to customers in St. Kitts and Nevis. Anything you purchase, you can get fresh from the market and delivered directly to your door. Log on to www.greenmarketskn.com. Click on the e-store link, choose your items, and shop away. We have a wide array of products from fruits, vegetables, local products, spices and seasonings, and much more. Save time and energy. Shop on greenmarketskn.com, your one-stop shop for fresh local produce.
Welcome back to this episode of Caring for You with me, Dr. Terence Drew. And this episode, we are dealing with lupus, where we went through the definition, the symptomology, the diagnosis, and the treatment. Now, I promised that I would introduce to you a special guest who would speak about her personal experience, and later on we'll talk about her organization and her campaign to inform the public and how you can join to help the lupus cause. So I want to introduce you now to my guest, Miss Victorine Hanley. Greetings, Victorine.
Hello, hi, Dr. Drew.
Thank you very much for being with us. And now I want to give you the opportunity to share with the public or the listening audience your own personal experience.
It's a pleasure being here and to share to the general public about lupus. I've been diagnosed with lupus for about 10 years now. And at first I had muscular pains, joint pain, swelling, and couldn't figure out what was wrong with me. And after doing several tests, they realized that I had lupus. So later on in life, I was diagnosed with Raynaud's and Sjögren's disease. So these are additional diseases that come with lupus. They call it mixed connective tissue disease. So I am married with 2 children. So I'm Mrs. Victorine Hanley.
Yes.
I have 2 children and they are healthy. They are 2 healthy children, 23 and 21. So coping with lupus has been a challenge. There are days when I wake up and I just can't move. I just can't function. I can't move around as freely as I would have maybe 2 days ago. And that is something that needs family support.
Yes.
It needs friends and family support. So I appreciate the support I get from my family and my friends when it comes to coping with lupus on a day-to-day basis. Getting up, getting ready for work, and work. Speak of work, I appreciate the support I get from my colleagues as well, because there are days when I just cannot function to go to work. And my boss understands, and that is what I love about it.
Yes. So let me ask you, before you go on, when you were first diagnosed, how did it hit you? How did your family respond?
I was taken aback. I was in shock, and I left the doctor's office and I went for a long drive. I went for a long drive because I had recently lost a friend of mine
Yes.
with lupus, and from reading and hearing about lupus, it's something that, well, people will say, oh, you're dead.
Yeah.
But after reading up and educating myself, I realized, hey, I can cope and live with lupus.
Yes.
So, yes, my family, they were shocked and taken back as well about it. But after we educated ourselves about how to deal with it on a day-to-day basis, it is smooth running.
Right. Right.
There are times when I end up going to the doctor and
Yes.
there's something new on the plate. I would sometimes get depressed.
Yeah.
It is normal to get depressed, but I am a Christian, so I meditate on God's word and music, and that usually helps to pull me back to cope.
Excellent. And as she speaks about it, I think it was Venus Williams who also have a connective tissue disease, an autoimmune disease. I think she might have Sjogren. And I think Kim Kardashian, I think, also suffers from an autoimmune disease. So the reason why I mention these people is that I want the population to understand that even if you are diagnosed, there's still hope that you can live a fruitful life. So anything else you want to share with us?
Yes, well, how I'm dealing with it now,
Yes.
I have changed my diet
Yes.
to being mostly plant-based, and it helps with the inflammation in the joints, etc. So I'm just encouraging persons out there to try eating plant-based. I know you would say it's expensive, and when I say plant-based or perhaps vegan, don't buy the stuff in the
That they are processed
supermarket,
too.
the processed stuff.
Yes.
Don't buy the processed food.
Yes.
You could make your meatballs from chickpeas or lentils.
Yes.
It bangs. It
Yes.
tastes good. Go down to the market or market there and buy your sweet potatoes.
Yes.
You use your string beans. You use your vegetables. It helps.
Yes.
It do helps with the
Right.
joint pains. I know when I changed my lifestyle to plant-based, about a week after, I was looking for the pain. I was looking for my normal pains when I
Yes.
get up in the
Yes.
mornings, and but I still take my medication, but
course.
because there are days when the plant-based just don't kick in, it still needs the medication
Yes.
to help. So I still do take my
Right.
medication.
So it's a comprehensive approach then.
Yes, it is.
Pharmaceutical and lifestyle.
And lifestyle,
What
yes.
about exercise? Have you incorporated that?
Yes, I do a little walking.
Okay.
For me, I can't do too much, and I
Yes.
do go to the seawater because and I go to the seawater early mornings or late afternoon because I can't do the sun.
Yes.
When Dr. Drew talk about sunburn, it does flare up my lupus. I do have flares. It actually irritates my skin terribly, and when I learned that the hard way, I got depressed too because I was like, I live in a tropical country.
Yeah.
Why can't I be able to go outside in the sun? And I learned how to cope with it.
Yeah.
I do take a little vitamin C every now and then
Yes.
in the sun, but so I do a little swimming and I do a little walking every now and then to put some little exercise in, because if I don't, my muscles, they really get weak. So you do need to do some exercise, some yoga, some stretches, because when your muscles do get weak, it's hard to pull them back to where you want them to be.
Right. And that is very important. Now, let's discuss a little bit about the cost in dealing with your condition. How expensive it is.
It is
Yes.
expensive. Well, I have blood clotting with my lupus.
Yes.
So at first I used to take warfarin, and the warfarin, it limits you to greens. You can't have any kind of greens. You can't have greens at all. Nothing to build your blood. So it was hard for me to try to do plant-based and feel like healthy. I've changed my blood thinner,
Yes.
and so I'm able to eat greens. So, but that one costs, it costs up to maybe $300, and that's just one of the medication that I have to get. So yes, I recently told myself I won't put a price to my health because I want to have a bit of greens in my system, a bit of those enriched green vegetables. So I went and I changed my medication to that one, and I still take the Daconil.
Is it Eliquis?
The Eliquis, yes. Yes, I usually I have the Eliquis now, and yes, it is costly. It's almost like $500 a month.
Yes. It's very expensive, but it has improved your quality of life.
It has.
Yes.
It has. I am glad that I am able to just have a bit of green vegetables in my
And less
diet.
blood tests.
And less blood. Oh, yes. Oh, thanks very much. I used to go to the hospital every month
Yes.
to do a blood test to ensure that my blood level remains in a particular range. So now that I am on that drug, well, it saved me that way to pay for the blood test, but I still have to input the monies towards the medication. But like I said, I put no cost to my health.
Right. And the cost of managing is astronomical. Maybe in your case, you have health insurance. So maybe those who don't have health insurance, and I see many patients who don't have health insurance, and I wish I can put them on these more advanced medication. And that is why, on the other side of the show, the last segment, we will discuss Victorine's organization that she has started, her plans for the awareness, and hopefully you can contribute to this organization to help those who need to defray some of the costs of these very expensive drugs to deal with lupus. So that would be a part of our outreach. So I want to tell you, let's see each other on the other side. And this is the episode of Lupus, Caring for You with me, Dr. Terence Drew.
Want to buy some fresh fruits, vegetables, or ground provision, but don't have the time to go to the market or even to find parking? Look no further. Green Market and Delivery is your solution. Green Market and Delivery is an e-commerce store that sells and delivers local produce to customers in St. Kitts and Nevis. Anything you purchase, you can get fresh from the market and delivered directly to your door. Log on to www.greenmarketskn.com. Click on the e-store link, choose your items, and shop away. We have a wide array of products from fruits, vegetables, local products, spices and seasonings, and much more. Save time and energy. Shop on greenmarketskn.com, your one-stop shop for fresh local produce.
Welcome back to this episode of Caring for You with me, Dr. Terence Drew. And this episode we have been dealing with lupus, and I've introduced you to our special guest, Mrs. Victorine Hanley, who has given you her own experience. In this last segment, we'll touch on summarizing lupus, but we'll go through, of course, as I promised, the new organization that has been formed to deal with lupus, the outreach and so forth. And I will ask Victorine to give you the information with respect to that. So Victorine, let me ask you, your organization which has started, I know that I participated in an activity in Connery dealing with lupus, and your organization was mentioned then. So I just want to give you now the opportunity to inform the general public about your organization and what you are doing.
Okay, we are a newly formed organization. We were formed in May this year, the 1st of May, and we are NGO, non-governmental organization, non-political as well. The name of the organization is St. Kitts Nevis Lupus Foundation, and the president is actually Mrs. Keisha Isaac, and I'm the vice president of the group. Well, our main goal for the group right now is to spread awareness about lupus, to increase public knowledge about lupus, and especially to the business enterprises, because we want them to have the understanding of lupus and how to go about coping, helping, aiding their staff members who have lupus, because I realize that there's a lot of people on island who has lupus.
Very true. Very true.
So we had some planned activities this year, but they didn't really come on because of COVID and the lockdown. So we are hoping that next year that we'll come off on a bigger foot, because a better foot, better leg, because I realize in October it's all pink, and I want for May it's all purple. Thank you. So to all the business places out there, ensure the 1st of May to the end of May, you purple up your place for lupus awareness. We're in the process of opening a bank account
Yes.
to help to gain funding and help assist persons who are living with lupus. So in the near future, you'll be hearing more about us and how you can help. But in the meantime, we have a support group that you can join. You can contact 660-8673. That's Mrs. Keisha Isaac. That's 660-8673. And you'll be able to join that support group and find out more information about our foundation.
Okay, excellent. So how often does the support group meet?
Well, right now we're doing virtual meetings until we find a stable place that we can just sit and just support each other on a face-to-face level.
Has it
right
helped, even in your case?
Yes, it has helped. It has helped because persons share food, menus, they share about the experience. They even ask about certain medical experience that they have, and wonder if have anybody had this experience, how do you cope with it? So it is helping. The group has been helping, and I am glad that we have stepped out and formed this organization.
And that is very interesting, because even understanding and knowing that there are others who are going through the same difficulties and would understand you and would not judge you and give you a safe space to be yourself and open up, I think psychologically that must be a tremendous, tremendous help.
It is a help, because
Yes.
there are times when person will tell it's in your mind.
Yes.
Or you're just thinking up that you're dreaming it,
Yes.
and it is not in your mind.
Yeah.
Lupus is real.
It's real.
It's real.
Right. And there's a wide spectrum, because people would look at you and never suspect that you have this.
No.
Because, and then there are those who are much more affected, and they would think, of course, no, she has to be making up this stuff. So I'm happy that your boss is understanding and he takes you very seriously, because in some situations, other patients are not given that privilege to be treated so nicely by their bosses, their
That is so
colleagues,
true.
and those who they work with. So I say kudos to your boss and to those who you work with. And of course, I know you have a very strong supporting family. So those two would have helped. So I hope you have heard from Mrs. Victorine Hanley, and she has given you the information on the organization, and she has said that they are ready really to purple up the place in May. I am already purpling it up, even though I'm in November. I'm in full support of this organization. Our young women are affected here, even some of our young men, by lupus. Is not a strange disease to us, and we don't want people to be really suffering in silence, but really can come out, be supported, get help if they need help, so that they can lead a fairly good life here in our federation. And she has mentioned how you will be able to contribute in the future, and I encourage you to give what you can, and I encourage you even further to make that financial contribution. And with that, I will bring this episode to an end, but I want to continue to encourage you to view Caring for You with me, Dr. Terence Drew, as we bring you pertinent medical information to inform you, your family, your community, and by extension the world, so that we can live healthier as a result. Thank you, and thank you for joining me once again.